Thank you very much, Len, for a great opening to today, giving us a real sense of context across the city in terms of the challenges we're facing. And what I'd like to do as the CEO of the District Health Board, I guess, is to carry on those themes, because it's quite fascinating to see how the agenda that we've begun to develop here at counties and the work of the Auckland City are now beginning to dovetail together with a very similar analysis and a very similar sense of solution to what it is that we can do. And what I'd like to really do today is perhaps start off by doing one thing, which is set a little bit of health context for us here, but then talk about two particular major practical themes, and within those challenges that I think are very, very important for us to maybe focus on this morning in the debate. The first one I'd like to really discuss about, which is a sort of sense of healthcare context, starts off with a quote from the current Swedish Prime Minister, Fredrik Reinhardt, who was recently interviewed, and the interviewer actually asked, why was it that a country like Sweden, which was much, much richer than it was the 60-odd years ago that it introduced universal pensions, that suddenly it was finding it really difficult to maintain universal superannuation? And his reply was, I think, in many ways incredibly illuminating. He said that when we introduced universal pensions at 65 in the late 1930s, everybody thought that was incredibly generous, but what they didn't tell you was the average life expectancy was 59. So the reality is now that in Sweden, where the average life expectancy is in the early 80s, do the math, you can begin to work out the impact that's in front of us. And in many respects, we've become the victims of our own success. In the early part of the 20th century, average life expectancy was 48. Now, it's nigh on, not far off, getting close to double that. The challenges that we have is really remarkable, because the interesting thing is that whilst people now talk about science in the near future, being able for you to live till you're 150, what they don't tell you is you'll be spending 70 of those years being 80, which is not necessarily the world's most interesting future. What we're facing, in many respects, I think, is a new revolution in healthcare, as important as the ones we've seen in the future. And I'd just like to acknowledge Muir Gray for the work on this. The first revolution in healthcare was about getting things like the basics of public health, sewage, for example, clean water, that eliminated areas like cholera. The second revolution in healthcare was very much around hospitals, around the growth in pharmaceuticals, the growth in what we could do with operations. Now that's coming to an end now. We have a health system very well geared up, actually, to deliver that in terms of operations and support for people. We can nigh and cure a lot of cancers, at least keep it in permanent remission, the way we could never have done before. But now we're facing a completely different set of challenges in front of us, surrounding an aging population, surrounding a population which is going to be having a series of chronic diseases for a lot longer than previously they would have done. Interestingly, if you look at the costs, if you have more than 3 comorbidities, the costs that you have in looking after you goes up very exponentially after you've had 3 comorbidities, and we have a lot of people in South Auckland with 3 comorbidities or potentially going into that in the future. We have to really begin to reorientate where our health services are focused on, accepting as well that people are much more informed now than they used to be, and certainly much more demanding than they used to be. If you go back only 30 or 40 years, the amount of information that you need to have to be a practicing clinician was probably about this high. Now, 40 years later, it's this high. The ability, I think, of clinicians even to keep up with the latest thinking and what's in terms of treatment is actually becoming a real challenge for us to manage all of that knowledge. And at the time, we have the internet and the explosion of knowledge that that brings. We are beginning to see some major shifts in healthcare, many of which we can describe, some of which we can guess at, but all of which will bring us a great challenge in the future. And it seems to me that actually we now have to therefore change our approach and our thinking in terms of how we respond to those issues. The first major thing I'd like to put on the table after that context is what I regard as the contribution health can be making in terms of the economic future of Auckland, making it a living place to live. The first issue, I think, is to say that Auckland's economy is made up of 10% is locked up in healthcare. And also, healthcare represents probably the largest single sector which is high-end. It's full of graduates. It's full of competitive scientists with a large amount of plant. Very, very innovative, competitive science goes on in terms of healthcare. It's also probably the one industry that can't be bought and offshored by the Australians or by the Chinese. It always has to be here. So if we are going to be, I think, basing ourselves as a high-end, developed economy, health has to be in there as a part of where value gets created economically. All other countries in the OECD are facing the same kind of challenges that we're facing. I mentioned Sweden earlier, but all other developed countries are facing these challenges. And we have to come up with solutions for them. So if we come up with those solutions, we should be turning into products and services that we should be using in order to generate income for New Zealand. And we can do that because already we've created Orion Health and created Fisher & Paykel Healthcare very much out of the hospital that we're standing in at the moment. We've done it twice. Let's do it 3, 4, 5 times. There are already 173 companies in South Auckland that are involved in some way in the medical devices supply chain. So if we really are going to be creating a future in terms of our economy, we have to embed health within it. Because it's probably one of the industries that has one of the biggest returns economically, and one that we're very well positioned to exploit. The other key issue, I think, about the economic case, where we should start seeing places like district health boards not just being places where money is spent, but where economic and social value is created. And I think that's a critical reframing of what we need to do with the public sector, is the fact that at the moment we are the largest employer in South Auckland, and therefore have a major, major stake in the economic well-being of this part of the world. And the interesting thing is that nothing closes the gap in terms of health inequality faster than jobs and education. And we offer jobs and education in spades. There is, however, an irony in my accent, and an irony in many of the accents you'll hear around the District Health Board, which was the traditional way that we've staffed the health systems. We train some, we borrow some that's trained elsewhere in New Zealand, and we import a lot. I don't think that is sustainable in the future. Health is now a global industry. We're facing global competitiveness. And we are not going to be, by dint of geography and money, the most competitive health sector in terms of salaries in the world. We're going to have to grow our own people in the future. But what's wrong with that? Why are we not backing ourselves? Because the critical issue for me is that actually we're surrounded by a sea of young people in Auckland who would hugely benefit from access to the kind of jobs and education that we offer. A charge nurse will earn $70,000 a year, which may not be a prince's ransom, but it's a lottery win to many families in South Auckland. It would hugely, hugely change, I think, the landscape of what we see. It will also hugely raise the levels of health literacy, which I think is a critically important issue that we're facing in terms of the effectiveness of what we provide. So one of the reasons why here we focus so strongly on our Grow Your Own project, which is about linking with people at the Middlemore Foundation and linking with the Tyndall Foundation to actually create health academies in our communities to keep kids interested in the sciences. I don't want children in South Auckland going off and doing an NCA in dishwashing at 13. I want them to remain actually actively involved in the sciences, to have their eyes opened to the kind of challenges and opportunities you can have if you keep the sciences going. Not just necessarily within healthcare, but the other kind of jobs that are provided as a result. And I'd just like to acknowledge the Equal Opportunities Trust, who've just given us an award for our Grow Your Own project. And it is amazing to see the kind of impact that it has on the lives of children. I had 2 children came up to me from my health academies during the award ceremony and said that this had given them a purpose in life, that finally they realized they could have a different future from the one that perhaps was being dished up for many, many of their fellow students. And one of the principals has said to me that for the first time ever, she's having to extend the science block in her school because of the health academies. She's having to buy more Bunsen burners and employ more science teachers as a result of the project of Grow Your Own. The thing is, it's not difficult to do. We can, because the energy and excitement you see in children's faces when actually you connect them effectively with what their futures could be is very, very dramatic. And again, that then takes me on to, I think, the second area where we need to be adding value. That's the social value. And I think the battle for, in terms of the effectiveness of the care that we provide for our communities and whether or not we're going to create vibrant communities which are going to be prosperous and educated in the future lies in actually what we do in terms of looking after our young people. We will not solve the issue of rheumatic fever in South Auckland simply by putting a screening programme in place. We will solve the rheumatic fever problem in South Auckland if we also tackle housing. The challenge we've got of ensuring a really great start for our young people lies in working across sectors, not relying on one sector to do it. One sector could do its best, but it can't be effective without working across each other and with each other. And so far, I think we're quite poor in being able to do that. And the challenge, I think, is being to create new models of working which enable us to develop new ways of delivering services. I recently went out with a public nurse team and went to a family in South Auckland who were really struggling. They were struggling because they lived in poor housing. And there were 6 people in the family, but because the house was uninsulated and poorly maintained by their landlord, they were all living in one room. And in that one room, one child had rheumatic fever. And as a result of that, the parents couldn't go out to work because they had to look after the child. That child couldn't get an education, but could pass rheumatic fever on to one of its 4 siblings. If you're caught in that downward spiral or caught in that stasis, you are not going to be able to move ahead with your life. And I think that family is greatly being let down by the services that we provide in South Auckland. And all we can do at the moment is mop up the damage. We need to get on the front foot and ensuring by working together we don't mop up, that actually we create value and make a difference. And that means working differently. It means not just the public sector working together differently, it means us also working with the private sector. In Sweden and in the UK and in Australia, they are talking about social bonds where businesses put up money and as a result of putting that money, services change and are invested in and public spending is saved as a result and that bond is paid back. I think that's a very interesting model we should think about following as a way of pump priming how we can make change happen. The work that we've done with the Tyndall Foundation it again exemplifies how across the sector you can begin to make change happen. So what I would say is the answer lies in partnership between the public and the private, between the state sector and NGOs, and between the functions and parts of the public sector we have at the moment. It's about how we work much more effectively with police, with housing, with health, with social care. And I genuinely believe that we don't have to necessarily put any more money into the system. We have to start using it smartly. In the UK, and here, and in many other jurisdictions, type 2 diabetes is a huge, huge impact in terms of people's health status. But because of poor control, 80% of it is wasted. Everywhere you look in the system, there are ways in which what we're doing at the moment is spending money to provide services which are poorly integrated together. I believe the answer lies in kicking the silos down, pooling resources together, and from that I believe we can create not just a livable city, but one which is very energetic, which is very prosperous, educated, and very, very progressive. Thank you very much.